So today we're going to dive into talking about specific cancer diagnosis, and this will be about bladder cancer. So you should be watching this, and this is for you if you fall into any of these groups. If you're a veteran diagnosed with bladder cancer and have questions, if you have a family member supporting a claim that deals with bladder cancer, anyone whose claim was denied, or if you have bladder cancer but you never filed a VA claim, or if you're a surviving spouse exploring DIC benefit, then this presentation about bladder cancer. My name is Dr. Camille M. Williams, MD. I'm a board certified radiation oncologist, Lieutenant Colonel retired, former enlisted MOS 54 Bravo, that's now C. Bernie. As a cancer doctor and a veteran myself, I help other veterans who are diagnosed with cancer and are seeking clarification, assistance with their medical records review, Nexus letter, and or independent medical opinion, or DIC. I have been on both sides of the fence. I am medical, I'm a cancer doctor, and I've also been on the military side, not just as an officer, but I also served 4 years enlisted. And so I understand when my enlisted colleagues are going through certain processes, especially when dealing with the VA claim and has questions and feel as though they're alone and don't know who to turn to. I'm here to help those who are like myself, who's been in the enlisted service, and I left my enlisted portion not even being aware of any veteran benefits. I did not learn about any of that until I retired from the Army with 24 years of service. So now I assist you, my veterans and colleagues, in trying to understand and decipher a lot of these language. So today we're going to start with bladder cancer. A lot of the cases I've done over the years has to do with bladder cancer and kidney cancer, amongst other cancers as well. But okay, so let's just talk about the bladder, the basics. If you've been diagnosed with bladder cancer, it just helps in going through the steps of writing your personal statement and talking about your exposure in knowing how the bladder cancer develops. You don't have to know everything, but understanding the basics sometimes just help you better grasp the gravity of what this is all about. So just the basics. I know this may sound simple, but the bladder stores urine before it leaves the body. And in storing the urine, you know, therefore, that there are certain things that can sit in there. You don't urinate all the time. And sometimes, based on your job, you may have to hold your urine for a long period of time. Now, this becomes very important if your kidney is filtering toxins, and then it has to sit in the bladder for a while. So cancer begins in the inner lining or the urothelium of the bladder. And the most common type of bladder cancer is a transitional cell carcinoma. And so let's talk about what that means for you, because the kidney serves as a filter, and it literally filter out any sort of toxin that you may come across. So yes, the kidney filters the toxin, but it goes through it, and some of the toxins that may cause kidney cancer may also cause bladder cancer, but that's a whole nother lecture. What I want to do, though, is just go through briefly and show you some of these things that we're talking about. So let me get my pen here. Should I get highlighter? Let's get an highlighter. So we typically hear about the kidneys and kidney cancer, and this yellow line here, maybe I should change the color. Bear with me here. Let's see. Let's change it to, well, not much else. I can change. Let's do black. So from the kidney, there's this little yellow line. If you can see, I'm right along there. And the kidney is responsible for filtering toxins out of the body. It's literally like a sieve. And so when it does that, all the toxin and everything that it sieves through, it comes and it sits down here in the bladder. This is just showing you a magnification of this part of your body, and is showing the urinary collection system. The kidney, or the kidney cancer, totally different type of cancer than the bladder cancer. Even the type of cancer that affects the urethra, this I like to call it like a straw that goes from the kidneys, total different cancer from the kidney cancer, and that makes a difference in a lot of the cases that I've done as far as your exposure, what the PACT Act will allow for and what the PACT Act will not allow for. But the most important thing for you to see here is just have an idea where these are located in your body, and you know where the bladder sits. And the important thing to take away from this slide is that if you've been exposed to toxin that has to filter through the kidney and it sieves through the kidney, then it sits in the bladder for a while before your bladder has the opportunity to excrete it, right? So the longer it's in contact with the bladder, the more often it's in contact with the bladder, that increase your risk of being affected with or having an issue and being diagnosed with bladder cancer. Now, the other thing that folks always ask about is what are some of the early signs? Typically, there are no early signs for bladder cancer, except maybe there may be blood in the urine. And most of the time, this will just be on a urinary analysis where they may see trace blood. For you to see gross blood, you need to get in right away. Later, you may have some increased urination or pelvic discomfort, but that's for later on in the diagnosis if the bladder cancer grows and then start invading in other organs, but then that's another discussion. But it's important for you to know just where the bladder lies, and you know you can feel it if you push just below your belly button. Then you know that's where your bladder is. You know when you feel like you need to urinate, right? And so there's also a lot of other, before I get into bladder cancer, there are also other types of conditions that you may be affected by based on the type of toxins that you've been exposed to. So be aware of that also. So why do veterans face higher risk? Higher risk because herbicide exposure, right? There's Agent Orange, that's the Vietnam era. There's contaminated water, such as with Camp Lejeune back in 1953 to 1987. Burn pits, those were some more recent conflicts. Industrial chemical solvent fuel tied to specific military jobs. So a lot of the cases I've been doing that are non-PACT Act, right, or non-presumptive bladder cancer diagnosis, literally tied back to certain MOS. When I was enlisted as 54 Bravo and I was stationed out in Colorado Springs at the 4th ID, I was in the motor pool quite a bit, and I would go down range with the 329 Field Artillery and those folks. So I was with the 52nd Engineer Battalion. So I was there doing a lot of stuff with other MOSs because as a 54 Bravo NBC, we do a lot of support. So I was with them while they were out there doing field exercises, etc. That's why it's so important to know the type of exposure that you had based on your MOS, right? So even though your MOS may not be that, I wasn't a field artillery enlisted personnel, but as a 54 Bravo, I was with them in support of them. So you need to understand what your MOS had you exposed to, the type of jobs that you had to do. I previously did a video on writing your personal statement. That's where all of this come into effect. What's your MOS? What you've been exposed to? How long were your duty hours? And all of that ties in. So the VA formally recognized several of these as linked to bladder cancer. So it's important to keep up with the PACT Act. A few years ago, before the PACT Act, we were doing a lot of Nexus letter and a lot of independent medical opinion trying to prove that certain diagnosis was linked to exposure while veterans were in the military. The PACT Act has removed that need to prove the linkage, but they still need additional stuff. So check out my 2 previous videos regarding that. So the good news is that bladder cancer is a VA-recognized presumptive condition based on the PACT Act, but you have to have a qualifying location, right? Were you in Vietnam? Were you at the Korean DMZ, Thailand, and other location? They have the list, and I know sometimes it can be buried, so what I'll do is I'll put at the bottom here where you can go to find out more about the PACT Act and what are some of the presumptive qualifying locations to see if you were stationed there. Now, if you were stationed at some of these locations and you were there during a certain time, then it's already presumptive, meaning that the reason that you are diagnosed with bladder cancer has been removed. You do not have to prove causation. That's what the presumptive service connection will allow. However, as in the previous video and I discussed, you still need to confirm your diagnosis and to provide the VA with the documentation, right, that they require. So presumptive is not automatic. Filing correctly still matters. So you still have to go through your VA credentialed personnel to see what's required. And if you need assistance with the cancer documentation with medical records review, you can visit us at q4cd.com. Now, Camp Lejeune, this is also an important occurrence when it comes to contaminated drinking water. If you were in that area 1953 to 1987, you were exposed to carcinogens, which are cancer-causing type of materials such as TCE, PCE, benzyl. You don't have to know what these actually are, just that if you were diagnosed with bladder cancer and a couple other cancers as well, a few other cancers as well, and you were stationed at Camp Lejeune, even if you went there for TDY or had certain training there, there is a time frame that's allotted for you to be considered. So talk to your credentialed VA specialist to see if you qualified under the Camp Lejeune contaminated water exposure, because they list bladder cancer here as a Tier 1 condition if you were exposed. So when it comes to filing for bladder cancer, the first hurdle, if you will, was taken care of because it was acknowledged. So you may be able to pursue both the VA disability and the CLGA civil claims. Again, this is beyond the scope of this presentation. You just need to talk to your credentialed VA specialist to find out what you are qualified for. Other exposures that are included in the PACT Act has to do with burn pits. Again, they aren't automatically presumptive, but it's not a dead end either. So if you were exposed to burn pits in Bahrain or in other areas where it's on the list, if you were exposed to solvents, fuels, and industrial chemicals, the 2022 PACT Act has now expanded, and they keep expanding, which is fabulous. That is awesome for veterans. That means you won't even need a Nexus letter or IMO. You may still need to get your information or your documentations together, but if you're under the PACT Act, the most important hurdle has already been crossed. So check your full service history before you assume that you're non-presumptive, right? Don't assume that you don't qualify. Talk to your credentialed VA specialist. I've been having a lot of folks coming and speaking to me, and I try to help where I can, but at the same time, there is a really broad, lots of information. Let's put it that way. There are lots of information regarding the exposures and the PACT Act. And it's not only cancer diagnosis, there are other conditions that are also covered. So you want to make sure that you take the time to go through whatever conditions you've been diagnosed with, look at where you were assigned, and see if you're covered under the PACT Act for presumptive diagnosis. One of the things that I work a lot with is the TERA, which is the Toxic Exposure Risk Activity. So there are some veterans who do not meet coverage under the PACT Act, but based on their MOS and other exposures and TDY assignment, they have developed bladder cancer. And now the question is, can I still receive a VA disability by putting in a claim, though it's not covered? That's what's called non-presumptive. So you don't have the coverage or the assumption that your bladder cancer was caused by where you were stationed or by certain dates. However, based on your MOS job, even if it's non-presumptive, you may still have a case. So that's something that we can talk about as well. The third point here is what the VA needs to grant service connection. You need to have a current diagnosis, and I cannot push this enough. You need to have a confirmed bladder cancer diagnosis that's documented. There are symptoms of trace blood that may not be connected to bladder cancer. There are a lot of other kind of diagnoses that can cause blood in the urine that may not be bladder cancer. So in order to go through this, you have to have a diagnosis. So the first question is, do you have a bladder cancer diagnosis? The second thing then, therefore, we look at, is there an event, a hazard exposure that occurred during your military service? Is there a link that we can do to connect your bladder cancer for while you were in active duty? Can we say this is an in-service exposure? That's the second part of it. So first, a diagnosis. The second, is there something that we can link it to? If there's not anything to link it to as far as within the PACT Act or within the time frame, then you may or may not need a medical nexus letter, right? So if you're covered by the PACT Act, I've been telling a lot of my veterans that you don't need a nexus letter, because by definition, what the nexus letter typically does is it shows that your diagnosis of cancer, which is what I cover, and your service in the military is connected. But the PACT Act is saying that, hey, we already know that, so you don't need a nexus letter. There's some folks who are covered under the PACT Act and just have a complicated case. Then there may be an independent medical opinion that's needed if certain things are denied or they want to increase their VA disability percentage, so it becomes different. So the medical nexus may not be needed. All right, so presumptive. Element 3 is established by law. Non-presumptive, you must build element 3 yourself. So that's all it is. It's just a freebie. It's just so awesome. For me, I'm excited for you that you don't need a nexus letter or have to go through that extra hurdle of trying to prove anything. It's already proven for you. If a nexus letter is needed, which in some cases you have a diagnosis of bladder cancer, right? Let's say you were in the Air Force and you work with certain toxin, or you have certain MOS because you use certain degreaser, or if you were in the Navy and you were exposed to certain things on a ship, or in the military, you were in the Army or the Coast Guard. We tend to leave out our Coast Guard folks. Or if you're in the Coast Guard or whatever it is. And that's why I do the VA case strategy consult, right? So I collect the information that you give. I don't collect anything. I don't have you scan anything up. You get to go through your record and tell me what happened, where you were stationed, what your exposure is. And just based on preliminary information, we can determine if you need a nexus letter or not, okay? So far, it's been about 50-50 where I review some cases and have the consult and it's, hey, you're already covered. You really don't need to do anything else. But here is what you can do. And don't forget, your personal statements still need to be done. So if a formal written medical opinion is needed from a qualified specialist for bladder cancer, an oncologist is the way to go, right? we can write the statement at least as likely as not, which means more than 50% probability. And I want you to know also that you don't need a 70%, you don't need a 90% probability. You just need to have a 51% that they will then do stuff in favor of you. You just need to show that it's at least as likely as not that your bladder cancer was caused by your exposure. So you must include your service records, medical records, exposure history, and the clinical reasoning. And that's not for you to do. That whoever is writing this Nexus letter will bridge the gap based on the information. And this should be written by a board-certified oncologist who understand a lot of the processes of how this all works and certain things that they're looking for beyond the at least as likely as not documentation. And there are now some new evidence showing that certain other toxin may also be linked to bladder cancer. I was pretty excited about that. So, fifth point, when a claim was denied or the veteran is passed, a denial is not the final word. It is just the starting point. If you've been diagnosed with bladder cancer and it's been denied, the first thing when you go to speak to an oncologist for this is to submit what the VA had said. Sometimes it's just a matter of documentation, right? So common reason, you're missing a nexus, incomplete exposure history, poor CNP exam. And a lot of times, if the nexus is not needed and there needs to be a rebuttal based on what was submitted, if the CNP exam was poorly done or the information within the denial letter wasn't clear, that is where sometimes that the oncologist comes in with providing information and just talking to the VA reviewer via the Nexus letter or via the independent medical opinion on your behalf. Again, I am strictly clinical oncology, just strictly cancer, right? So I do not do other diagnosis. So the timeline matter after denial. So don't wait to seek a review. There is a specific timeline by which you must submit additional information that's required. I'm going to leave that homework up to you. The surviving spouses, if this is a case regarding indemnity compensation because a veteran has died and you think that there's a service connection for this that caused the death, it's much more in-depth review. So even if no claim was filed, a medical record review may identify a path. This can take some time. Do not delay. If you have questions, let's connect. This is how we can help. First, everything goes through a VA case strategy consult. Knowledge is power. So an initial consult first before anything else. And if it is that you need someone else, I will give you information and encourage you to speak to your VA credentialed specialist. So I want to thank you for spending time with me today, for allowing me to be part of your day. I hope this was helpful to you. Please do share with other veterans that may benefit. Like, subscribe, ring the bell so you'll know whenever I upload another video. I want to thank you for your service. Thank you for spending this time with me. I do not take it lightly. Until next time, you take care and God bless. Bye-bye now.